Hi guys, so today I'm going to show you how to do some stretches that's quite useful for Osgood-Schlatters. Osgood-Schlatters is pain that kids develop at the front of their knees, kind of where this knobbly bit is on the shin bone. I'm going to show you a few variations because it presents differently in different children. Sometimes it can be really inflamed and sore and then it doesn't cope with stretching very well and you've got to allow a couple of weeks for it to calm down first. Welcome, my name is Marika and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. Osgood-Schlatters develop when the quadricep muscle is too tight and it pulls excessively on the insertion where the tendon inserts into the bone. So what we want to do to help prevent it or fix it is to lengthen this muscle at the front. But now you can imagine if you do a really strong stretch like this one, where it really pulls over that bit, if it's really inflamed in that area, that will make it feel worse. So we've got to play around with things to see what the kid will allow or what the pain will allow the kid to do. My first choice of stretch is always this full-on one where you get full hip extension first because the muscle runs over the front of the hip as well as the knee, and then you grab hold of your foot. But if the knee is really painful, you won't be able to put pressure on the knee, or it may be too much to catch it because it pulls too much on that bit. So then you'll have to do a stretch in standing. So I often, if it's really sore to put pressure on the knee or it's painful to catch the foot, I get the kids to first start and just stretch out the front of the thigh. So if you've got your feet in a stride stand about a good step apart, you bend the back knee and you hold on because it's not a balance trick, and you'll feel a nice good old stretch over the front. If they don't feel the stretch, just check, are they there? Because then you take the strain off. Are they leaning back with their backs rather than their pelvises? It should be the pelvic tilt that brings the stretch on. Now, as soon as that has calmed down a bit and you are able to put pressure on the knee, I would advise going into this stretch because it's the best way to get the full length through it. And again, if it's really tight, you may have to spend time and first stretch out the front of the thigh or closer to the hip joint and just hold that for 30 seconds. So in cases where they really have struggled to get hold of the foot, I get them to hold it for 30 seconds, do the other side while they're resting and do it at least 3 times. And then after that, I get them to grab hold of their foot and do the full on stretch. Now you'll notice I want to go into this position where if I'm there, don't feel much of a stretch there. You've got to push your hip forwards as well, that you get a good old stretch over the front. And I'm not arching my back, I'm actually pushing the front of my hip or my pelvis forwards to get that stretch. It has to be done pain-free, so no pain allowed in the knee where their pain is, and they've also got to be pain-free after doing it. So if they really can't put pressure on that, then you could also do the standing stretch in full. So remember, we've done this bit now just to loosen that off. Then you could also do the one where you catch it, but now be careful. I don't want to see the knee in that position because now you're not really stretching this muscle. You have to bring the knee back so that you get more of a stretch in there. It's more important to get this stretch than to try and get the heel in, because again, there I don't really feel much of a stretch because I've allowed my hip to come forwards. You have to get the hip back and then bring that in if you want to do it that way. So for kids, they react really quickly to stretches, and if they do it regularly, you see a very good increase in flexibility within 2 weeks. What I tend to say is, again, it depends on how flared up the child is at that point. So if the knee is really, really painful, they may have to cut out sport a little bit for a week or so before they can start with the stretches. And then I usually want them to do the stretches 2 to 3 times a day for 3 times 30 seconds each time. Doesn't fit in with all of their schedules because they are very busy as well. So if you can manage once or twice a day, perfect. But on weekends where they're not that busy, if they can put in a little bit of extra effort, they'll see better results. So normally I get them back to 80% of their full flexibility within 2 weeks of stretching, and then it can take about another 2 weeks to get the last bit. But remember, when you go back to sport, it's not bang into all of the sport immediately. You've got to kind of taper it in. I've put a link in the comments, or actually in the description of the video, that will take you to an article where I describe my whole treatment process, because stretching is really just a tiny part of it. Okay, let me know if you've got any questions. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.